We are joined right now by Dr. Carl Lambert, a primary care physician with Rush University Medical Group, here to answer some questions. Thank you so much for being with us, Dr. Lambert.
No problem. Good morning to you.
Good morning. And again, I know it's the holiday week, so thank you for making time for us. So obviously, people are gathering. It's going to be a busy, busy time. But there are some major concerns here, including whether or not you're vaccinated. Are you still capable of spreading this variant? We're seeing a lot of breakthrough cases, but how contagious are you, even if you've had your shots and your booster?
That's a very good question. So the data is still being determined for that. But I do want the viewers to know that this variant, the Omicron variant, it's incredibly contagious. It rivals the likes of measles. So unfortunately, we are seeing patients who are fully vaccinated, and even those who've gotten boosters, that they still can be what we call asymptomatic carriers. So they may not have symptoms themselves, but they're still able to shed the virus and spread it to others. So if you're having in-person gatherings, indoor gatherings, you still have to be very, very careful during this time.
One follow-up, the Delta CEO who is mentioning that he wants his staff who are vaccinated to come back after only 5 days of quarantine versus the 10 days that we've all become used to. How is that safe? Can you just explain, if you are vaccinated and seeing the mild symptoms where you're only sick for a day or two and then all of a sudden all the symptoms are gone, the fever is gone, is 5 days enough of a quarantine where you are no longer contagious?
Yeah, it's a great question. It really depends upon if you're symptomatic or not. So per the CDC guidelines, if you're asymptomatic and you've been exposed, then you could wait about 3 to 7 days to even get tested. So even if you do come back to the office again, you have to be incredibly careful. And the main thing that I want to push is to make sure that you're masking at all times. Since we know that this variant is incredibly easily transmissible, masking is going to be the way to go if you even come back, whether it's 5 days or 10 days.
Okay. Well, as soon as I heard that, I thought, okay, how is that safe? And why haven't we heard this before? But you brought up testing. What is the proper testing window? So someone's been exposed to the virus, right? When should they be tested in order to receive the most accurate results as to whether or not they have COVID or not?
Yeah, that's a fantastic question. And it's a complicated question. So that's a question that I would have viewers, you would coordinate with your primary care doctor to determine what's the right time for this. And it really comes down to three things when I talk to my own patients. So really your vaccination status, if you truly have been exposed, and then also if you're having symptoms. So if you're having symptoms of any kind, you should be tested right away. And we can help to determine if that needs to be in office or if we can even send at-home kit for you to be tested for your own safety. If you've been exposed and you're vaccinated, but you're not having symptoms, then again, you can wait about 3 to 7 days to be tested. But I'm seeing a lot of patients that are saying, it's the holidays, I'm trying to get together or even travel. I want to get tested sooner than that, and that's totally okay. But if you're unvaccinated and you've been exposed, or if you've had symptoms of any kind, again, you should be tested right away.
And if you're vaccinated, is a different testing window than somebody who's unvaccinated?
Correct. If you're vaccinated, you're not having symptoms, but you've been exposed. And then again, exposed means that you've been within 6 feet of someone with known COVID for about 15 minutes or more, then you're actually okay isolating, quarantining, and getting tested about 3 to 7 days after that exposure. Okay. But of course, if symptoms start, you should get tested right away. So again, very complicated situation that oftentimes you should partner with your primary care doctor to really discuss and talk about together.
Right. I'm sure there are a lot of people who are standing in those long lines. They don't have any symptoms. They just want to get tested because they think they've been exposed, or they want to make sure they're okay before they go see family. Really, really quick, we have 20 seconds. The vaccine for kids. What is the consensus now on booster shots among the medical community, and how long should people wait to get the booster if their children have already been vaccinated with those first 2 doses?
Yeah, that's the $1 million question right now. So we really don't know that quite yet. So information is still mounting because, again, authorization for vaccines for kids, say, 5 to 11 or 12 to 15, that came out in May and October, respectively. So the data is still being determined as far as, in that group, are we seeing a lot of breakthrough cases? Hopefully not, because we know that children's immune systems tend to be a little bit more robust and they tend to be more resolute. So hopefully they may not need a booster. But again, we have to find out over the next couple of months what that would look like.
All right, Dr. Lambert, thank you so much. Very, very good insights here that we are going to share on our social media and our website. Thank you again. Thank you so much for watching. Make sure to click on the red subscribe button below so you can get more of News Nation's fact-driven, unbiased coverage.